Hello and welcome to Mission in Focus. Two questions Catholic Health Australia is often asked are: how extensive is Catholic health and aged care in Australia? And what is distinctive about working in Catholic health and aged care? To explore some of the answers, please join me in conversation with 5 leaders as we discuss what is distinctive about working in a Catholic organisation, the importance of the charisms of founding orders, and some of our special obligations as we encounter people in what is often a vulnerable time in their life. I started by asking Catholic Health Australia's CEO, Suzanne Greenwood, how extensive is Catholic health and aged care?
Catholic health and aged care providers in Australia together form the largest provider grouping of health and aged care services in the country. So Margaret, more than 1 in 10 Australians who's receiving hospital care today is receiving that care in a Catholic hospital. And when we turn to aged care, our aged care services are providing services to even greater numbers of Australians, particularly when we look at the home care space, which is growing at a terrific rate in Australia. One of the key things about all of our Catholic services that may not be so well known is that they're all not-for-profit providers. And what that means is that any revenue that is raised by the services is actually put back into programs and services that support the communities in which those services are operating and support Australians generally. You don't need to be Catholic to work in one of our services. You don't need to be Catholic to come to one of our services. At the end of the day, what we're looking to achieve is better health outcomes for all Australians.
John, you've been working for Catholic health and aged care and social services organisations now for a big part of your career. What makes working for a Catholic organisation distinctive?
It's an interesting question. I think there are many things that make working in this sector distinctive. There's the story of the founders, for a start. In my case, working with the Sisters of Mercy in Brisbane, they have a wonderful story going back to their foundress, Catherine Macaulay. And it's been a great privilege to work with the sisters and for the sisters in carrying Catherine's vision of care and support in the community into contemporary Brisbane and near environs. So that's one aspect of it. I think a little deeper than that is understanding the theology that sits underneath that vision of service and that mission of service to people, and understanding the why, being able to say, well, it's not just good humanitarian values, there's actually a theological purpose here to extend a mission into the community and to lead by example. Whether one's Catholic or not, that's an inspiring thing to attempt to do with your professional life. I think the dedication of the staff that I've worked with in the Catholic sector is outstanding. Their willingness and ability to understand the whole of the person, to get beyond the technical aspects of care and the professional aspects of care, and to dig deeper to understand the person, to respond to all of their needs, not just small c care, but perhaps capital C care.
So John, you referred to the foundress, Catherine Macaulay, for Mercy. There are a lot of other founding stories in the Catholic system. How relevant is a founding story for today's care?
I think it's a great source of inspiration. If you take the time to understand the foundress, most of them seem to be foundresses, that it gives you a better understanding of how they might have reacted to today's circumstances, to today's societies, the challenges of care in today's world, which is clearly a very, very different world. But I think if one understands what they were trying to achieve, then it's easier to wrestle with some of the problems of what to do and how to do it. It's a great source of guidance and inspiration.
John, in your positions, leadership positions, CEO, board member of various Catholic health, aged care and community care organisations, what do you see as the glue that binds Catholic providers together?
I think clearly we're all parts of the Catholic Church, and ultimately that is the glue that brings us all together in one form or another. At a more local level, perhaps, within Australia, there are, as you said, lots of different founding stories of the different groups that are now parts of the Catholic Health Australia membership. Catholic Health Australia, the organisation, rather than the sector, actually helps bring us together and provide us with a forum where we can talk about like problems, solve issues, get Catholic Health Australia to represent us in the political world that we operate in. So there's a lot of practical things that bind us, as well as obviously the story of our respective founders and the theology that underpins that mission of service.
John, a lot of the people who work in our organisations are not Catholic. The people who come into our organisations for care are not Catholic. So when you're working for an organisation and you have difficulty working for a Catholic church organisation, how could people manage those difficulties?
If you're an engineer and you go to work for BHP, there are rules and regulations and instructions about how to work that are not the same as if you're working with Rio Tinto. And you just need to learn. You take your professional skills, you're working in a different environment, in a different culture, in a different company. And it's the same whether you're working for the St John of God system or the Calvary hospitals or the Mater hospitals. Each of them has their own rules. Many of them are similar because they're inspired ultimately by the same mission of service. But every company and every employee has to learn what's the organisational culture, what are the rules, how do I work here? And I don't think the Catholic Church and Catholic Health Services are any different.
In the Catholic Health and Aged Care Ministry, we refer to charism. How do you see charism working today?
Charism is a gift. It's a spiritual gift. And it's been handed to us as far as trustees are concerned. And I think we hang on to that. It's very precious because it gives clarity to enable us to make decisions which are consistent with the charism of our founding order. So, for example, if a recommendation or plans or decisions might be coming up to the trustees from the board, we would be looking to assess the suitability or the alignment of that recommendation or plan or decision within the broader charism of that which we've been entrusted with. So the founding stories and the charism of many orders or public juridic persons will differ according to their founding story and their charism. But for us, the charism is very strong in that it's the Spirit of Christ urges us on. And there is a particular focus on preferential option for the poor. And we define that poor not in financial poor, but in disadvantage, those who are vulnerable. So it drives everything that we do, and I would call it an enabler. And we refer to that constantly, both amongst ourselves, but in alignment with the board, our management, our staff within our ministries, as a form of encouragement and as a form of clarity. Because I think in this day and age, there are many demands on our ministries. The charism is there to enable us to make competent, wise stewardship, because every time we put resources into one aspect of our ministry, it is at the sacrifice of something else. So it gives us clarity and enables decisions which adhere to what we feel are the most important things for our ministry.
What would you say is different about working for the Catholic Church than another provider?
It's a good question and a daily challenge, I think, for any of us working in Catholic ministry. It's a larger view of what we're here to do. So we don't have a monopoly on compliance and obligation, nor on excellence, nor on research, nor on innovation. However, we have an expectation of ourselves, those we assist, whether they be patients, whether they be beneficiaries of our services, whether they be clients, whether they be the companions we walk with. All of them have an expectation of us, and we have an obligation to them, that their full story is explored. So how we heal in a health ministry or an aged care ministry is not about a transaction of a service. It's actually a companioning of that person. It's a presence. So the obligation here is around a holistic view of service provision that will, in one level, never be completed. It's a desire for the greater good of this person who is in our care. It's a desire for them not just to be in our care, but to heal and flourish in their own community, in their own family. And it's a desire for them that actually they far more integrate back to or make a new sense of meaning in their lives through the story of illness, of crisis, or the stories that have actually sort of said, 1 minute, my life's now reoriented. So the obligation of our care is to be holistic. I'd say one of the things that it's easy to dish in a Catholic community, if you're not familiar with it, is to say, oh look, the pastoral is someone else's responsibility, it's the pastoral care person's role. Or the mission, well the mission, the director of mission will take care of that. Or the moments of Catholic wording, oh that must be the CEO's job, or the board's job. Actually, the obligation is on each and every one of us within the ministry, because what we do is we all take on a common appreciation of the human person we are to heal, to care for, to walk with. And we all have to have a sense of, wait a minute, the person here is more than just a knee operation in that bed, or more than a person suffering with dementia in room 13. They're actually the story of Anna and her family. And even if her story is no longer one she can articulate, it's one that still has made her have a meaningful life. And it's that seeking, that desire to know the person and what inspires or has given them aspiration in their lives is something we value. I think the other part of obligation, though, for a Catholic ministry is to do the best possible service delivery, whether that's health, aged or social service care. And what I mean about the best is, because we have a belief in the inherent human dignity of each person, therefore the contract with that person, because of our belief in their dignity, is to provide everything that allows that dignity to shine forth. So excellence in care is not an option. It should be the standard. That's the obligation we have, whether that's at a tertiary or quaternary hospital teaching environment, or whether it be on a soup van that Vinnie's might run in the middle of some metropolitan centre in Australia. All of those should be done with a sense of excellence, because that's what human dignity requires, is the best care possible.
Lisa, what does working for a Catholic organisation mean to you?
For me, working in a Catholic church organisation means that when people encounter us, what they encounter is that real opportunity for transformation, that we care for them in their vulnerability, and also too that they know that this place is a place of healing and a place of hope. We get to see so many needs in society, and we have the gifts and the opportunities, the professional skills and the deep compassion and commitment to be able to try and meet those needs, which is our mission. Our mission is one of the healing ministry of Jesus. And for me, what that means is that when a person comes to our hospital or comes to one of our aged care services, that they feel more loved. We are encountering people often at the most vulnerable point in their life, and people need beautiful care at that point.
Lisa, your organisation was founded by a religious congregation, like many of our Catholic hospital and aged care systems. What impact do you think they had and still have today?
I think that they've made an incredible impact on Australian society, and the reason why I think that is because people are inspired when love is made visible. And the religious orders and congregations who established our hospitals, for St Vincent's, that was the Sisters of Charity, or be others for other organisations, they didn't sit idly by when there were desperate needs around them. So whether those needs were related to social services that were required, or people in poverty, or health needs, or education, the sisters and the other religious organisations took action. They took action. It's no wonder then that other people such as me, or other professionals, or people who shared that common mission joined them. And therefore you can see that many of the works that they began still flourish and are still desperately needed in Australia today. One of the things that is amazing about religious orders is that they have a prophetic edge, which means they see a need, they're able to call out something, they're able to be inspiring and move towards work that others might not be ready to move towards yet.
For more Mission in Focus episodes, visit the Catholic Health Australia website and follow the links on our homepage. I'm Margaret Deeren. Thanks for being part of the conversation.